We've all been there, right? That sudden, sharp, and honestly, pretty terrifying pain in your stomach. It just grips you, stops you dead in your tracks, and your mind immediately starts racing with one big question.
How do you know if it's really serious? I mean, how do doctors, in the middle of a chaotic emergency room, figure out what's actually going on? How can they tell if it's just, bad pizza or a life-or-death crisis that needs an operating room, stat? Well, that's exactly what we're going to break down.
We're going to look at this really powerful method doctors use called FAMUS to bring some order to the chaos. We'll start with F for the absolute scariest, most fatal conditions. Then, we'll walk through other common causes, even some tricky ones that are like problems in disguise. And then, we'll wrap it all up with a super simple 5-question rule that helps them figure out what's going on fast.
So when a patient comes in with severe abdominal pain, the list of what it could be is, well, it's huge, it's overwhelming. So doctors don't just start guessing, they use mental models. And one of the best is a special memory tool, a mnemonic, that helps them work through all the possibilities, one by one.
A mnemonic is really just a fancy word for a memory aid. It's a simple trick to help you remember something complex, especially when you're under a ton of pressure. And believe me, the emergency department is all about pressure. The one we're going to talk about is called FAMUS.
So what does FAMUS stand for? It's fatal, appendicular, medical, obstructive, urogenital, and systemic. Think of it like a doctor's mental checklist. It forces them to start with the absolute worst-case scenarios first, the things that could kill you, and then methodically work their way down the list, from common surgical problems to medical issues to blockages, and even pain that's not even coming from the abdomen at all.
Okay, let's dive right in. We're starting with F, for fatal. These are the big ones, the conditions where every single second, literally, counts. Missing one of these can be absolutely catastrophic, which is why they're always number one on the list to rule out.
And in this fatal category, there are 3 major diagnoses that you just cannot miss. The key to telling them apart? It all comes down to very specific, very critical details.
And this is where the details are everything. For a ruptured abdominal aortic aneurysm, or AAA, the patient often describes a sudden tearing pain. For a perforated viscus, which is basically a hole in an organ like the stomach, the belly becomes hard as a rock. Doctors actually call it board-like rigidity. But the trickiest one might be mesenteric ischemia. That's when blood flow to the intestines gets cut off. And the key detail here is pain that is completely out of proportion to the exam. The patient is in absolute agony, but their stomach feels soft. Every one of these clues points to a different, deadly emergency.
All right, so once the truly fatal stuff is ruled out, the investigation gets broader. We start looking at the more common surgical and medical problems. And again, the diagnosis is hiding in the details of the patient's story.
The A in FAMUS stands for appendicular, which covers 2 classics, appendicitis and cholecystitis. That's gallbladder inflammation. So how do you tell them apart? The details. Appendicitis pain famously migrates. It starts near the belly button and moves to the lower right side. Gallbladder pain, though, it stays put, right up in the upper right, and it's often triggered by a fatty meal. Why? Because fat makes the gallbladder squeeze, and if it's inflamed, that causes incredible pain. It's a direct clue.
Moving on to M for medical causes. These are just as important because surgery isn't the fix here. For pancreatitis, the classic clue is the severe upper stomach pain that just drills straight through to the back. Then you have something like DKA, a complication of diabetes. The stomach pain is very real, but the actual problem is metabolic chaos. And of course, there's good old gastroenteritis, that familiar crampy pain, but it's the diarrhea and vomiting that really give it away.
Okay, now we get to the really tricky letters, O, U, and S. These are the problems in disguise. This is where the pain you're feeling might not actually be coming from where you think the problem is. We're talking blockages, urogenital issues, and pain that's referred from somewhere else entirely.
So, O is for obstruction, but a blocked intestine feels totally different from a kidney stone. A bowel obstruction gives you these painful waves of cramping, what doctors call colicky pain. But a kidney stone, that's a severe, constant pain in your back that wraps around to the groin. And patients with kidney stones are famously restless. They just can't find a comfortable position.
And this part is just brilliant, because it shows why doctors can't get tunnel vision on the abdomen. The U and the S force them to think outside the box. A ruptured ectopic pregnancy, for example, is life-threatening and shows up as lower abdominal pain. But S for systemic, this is the ultimate don't-miss detail. A heart attack, or even pneumonia in the lungs, can show up as severe upper abdominal pain. It can fool everyone if the doctor isn't thinking broadly enough.
So, with all this information, how does a doctor pull it all together when the pressure's on? They don't have time to slowly go through every letter of famous. Instead, that whole framework gets boiled down into a rapid-fire mental checklist, the 5-question rule.
Just 5. That's it. These 5 questions can help a doctor sort patients into really sick or not so sick in less than 30 seconds. It points them toward the most likely and, more importantly, the most dangerous possibilities right away.
Let's run through them. Number 1. Is the patient in shock? This immediately checks for the big, fatal causes, like a ruptured AAA. 2. Is there guarding or rigidity? This is that board-like abdomen we talked about. It points to peritonitis, a really dangerous inflammation inside the belly. 3. Is the pain colicky or constant? Just that one little detail helps them think about a blockage versus inflammation. 4. Is pregnancy a possibility? An absolutely vital question to rule out a deadly ectopic pregnancy. And finally, number 5, are there any other red flags? This is the catch-all. It's the final check to make sure no other critical detail has been missed.
From that board-like rigidity to pain that's totally out of proportion, the diagnosis is so often hiding in these critical details. By using a system like FAMOUS, doctors can decode the crisis. So now that you've seen the breakdown, what's the one don't miss detail that's going to stick with you?